Good morning everyone. My name is Anjani Devi, Associate Professor, HOD Department of Mental Health Nursing, Faculty of Nursing, Rama University, Uttar Pradesh, Kanpur. So today we will discuss regarding to the one of the treatment modalities in mental health nursing, that is electroconvulsive therapy. So coming to the introduction part, so the electroconvulsive therapy sometimes we will call as a physical therapy or somatic treatment for the mental illness. See, any psychotic conditions or severe conditions, they are mostly going for the electroconvulsive therapy. So to coming to the introduction, today we will discuss regarding to the electroconvulsive therapy. So that is somatic treatment. So in the year of 1938, Benin and Sertlin, so they proposed the electroconvulsive therapy. The previous period they will called as a electrical shock therapy. So coming to the definition, so it is the artificial induction of grand mal seizure through the application of electrical current through the brain. The stimulation is applied through the electrodes which are placed either bilaterally in the frontotemporal region. So we have to apply the, coming to the definition part, so we have to apply the electrical current through the brain. The brain can be produced to the grand mal seizures. That type of therapy we will call as a electroconvulsive therapy. So it is the artificial induction of grand mal seizures through the application of electrical current through the brain. The stimulation is applied through the electrodes which are placed either bilaterally in the frontotemporal region. Both side, dominant side also we can apply the electrodes. So coming to the parameters of this electroconvulsive therapy, how much current we are use, how much duration we are going to use means, so the voltage will be the 70 to 120 volts, 0.7 to 1.5 seconds we have to apply the electrode through the brain to the patients. The frequency will be the 3 times per a week, and the total 6 to 10 up to 15 to 25 may be preferred as patients require. So these are the parameters we are using. The current voltage will be the 70 to 120 volts, 0.7 to 1.5 seconds, and frequency will be the 3 times per a week, and total 6 to 10 up to the 15 to 25 may be based on the patient conditions. Next move on to the types or techniques of ECT. So mainly based on the application of electrode and based on the giving of medications, mainly 4 types we are seeing to the electroconvulsive therapy. So one is direct ECT, indirect ECT or modified ECT, unilateral ECT and bilateral ECT. See, if we are taking into the direct ECT, so they are giving to the ECT into the direct to the patient without any anesthesia drugs or any muscle relaxations. Directly they are application of the electrode to the patient temporal region. And if we are taking into the direct ECT or modified ECT, they have to induce drugs induced muscle relaxation and giving of general anesthesia. So they based on this mainly 2 types. One is direct ECT and indirect ECT, and the third one will be the unilateral ECT. The unilateral ECT based on the application of electrode, so they have only one side of the head, usually non-dominant side. That means right side they are applying the electrodes and giving to the ECT, and second last one will be the bilateral ECT. See, in this bilateral ECT, the most common, most effective, most cognitive dysfunction we are observing. So both sides they are applying into the electrodes, that is 2.5 to 4 centimeters or 1 to 1 inches above the midpoint of the ear or temporal region they are applying the electrodes. These are the mainly 4 types or techniques of ECT. direct ECT, indirect ECT, unilateral ECT and bilateral ECT. So, next move on to the indications. So, when we have to give the ECT to the patient. So, the first one will be the severe depression. The severe depression patients and patients risk with the suicide. The patient is having the stupor stage and the patient is a decreased or poor intake of food and fluid. Patient is condition is the melancholic disorders. So, the mainly the severe depression cases and mania and severe catatonia and schizophrenic psychosis and other organic mental disorders. The other organic mental disorders include any mood disorders and organic psychosis that can be include. Other indications, the other indications include organic catatonia and neuroleptic malignant syndrome and Parkinson's disease. These are the main indications of the ECT: severe depression, patient with the suicidal risk, stupor and decrease or poor intake of food and fluid, and patient is having the melancholia and manic conditions, severe catatonic condition, schizophrenia with psychosis and organic mental disorders, so that it will be the mood disorders or it will be the organic psychosis, and other indications including the patient is having the catatonia, neuroleptic malignant syndrome and Parkinson's disease. So, next move on to the contraindications. So, mainly two types of contraindications we are observing into the patients. One is absolute contraindications, second one will be the relevant contraindications. So, if we are taking into the absolute contraindications, the patient increased intracranial pressure will be present, and coming to the relevant contraindications, the patient is having any cerebral aneurysms or hemorrhage or brain tumors, and then acute myocardial infarction and congestive cardiac failure patients and pneumonia and other retinal detachment disorders. So, these are the relevant contraindications for the electroconvulsive therapy. Mainly two types of contraindications. One is absolute contraindication, second one relevant contraindications. The absolute contraindication, the patient is having the increased intracranial pressure, we should not give the ECT. And relevant contraindications, the patient is having the some kind of disorders like any cerebral aneurysms, hemorrhage, shock or any brain tumors, acute myocardial infarction or congenital heart diseases or pneumonia, any retinal disorders, we are not prefer the ECT. So, next move on to the mechanism of action. So, there is no exact mechanism action of ECT, but possible conditions the ECT will be affect on the like as a antidepressant drugs. So, mainly here no 5 theories will be involved into the mechanism of action of ECT. So, next we will discuss regarding to the that mechanism of action or theories of ECT. So, there is no exact mechanism of action of ECT, but that will be ECT is act like as a antidepressant drugs. So, here some of the possible theories will be present. One is neurotransmitter theory and neuroendocrine theory and anticonvulsant theory and brain damage theory and psychological theory. These are the 5 theories that should be involved into the electroconvulsive therapy to producing of the grand mal seizure to activation of the brain. So, next move on to the side effects of the ECT. So, if any procedure or anything it will be happen, some of the effects will be there and some of the purposes and some of the side effects will be present. So, if we are taking into the side effects of electroconvulsive therapy, so impairment of memory will be present, poor concentration and anxiety, headache, nausea, vomiting, drowsiness, confusion, restlessness, dryness of the mouth, palpitation, backache, muscle ache and tongue bite and incontinence. All like generalized symptoms should be present into the side effects of the ECT. So, coming to the ECT team, so the ECT team will be the psychiatrist and anesthesiologist and a trained nurse. See, if you are giving to the ECT, we have to provide to the 3 types of rooms. One is pre-ECT room or recovery room or ECT room and post-ECT room, that is the post-recovery room. So, these are the 3 rooms we should provide to the patient. So, next move on to the nurse's role and responsibility. Here 3 phases will be there. One is pre-operative, pre-ECT care, intra-ECT care and post-ECT care. So, if we are taking into the pre-ECT care, so we have to assess the patient condition. So, in this you have to collect in detail history of the patients, like psychiatry history, patient is taking any anticonvulsive drugs, like that you have to collect in detail history of the patients and do the mental status examination, and you have to take the informed consent from the patient as well as the family members. So, here we have to explain procedure to the patient as well as the family members. So, what will they are doing into the pre-ECT procedure and intra-ECT procedure and post-ECT procedure, you should explain to the patient as well as the family members. We have to assess the vital signs. We have to assess the patient vital signs like temperature, pulse, respiration and blood pressure. So, next you have to assess the patient conditions. So, we have to take informed consent, assess the baseline vital signs. After that, you have to stop the anticonvulsant drugs before night and keep the patient in the NBM and advise the patient remove the jewelries and should avoid the tight cloth and ask the patient any drugs is there, means we have to withhold the morning medications, and then you have to keep the bowel and bladder is empty, keep the patient is the NBM, that is nil per oral state, you have to keep the patient and administer the pre-ECT medications. 0.6 milligram atropine you have to administer and succinylcholine you have to administer before 30 minutes of the ECT. So, this is the pre-ECT care and pre-ECT role and responsibility of the nurse. So, next move on to the intra-ECT care. So, next one intra-ECT care. So, in this after patient receiving into the ECT room or OT, that is operation theatre, so you have to provide intra-ECT care. So, the place the patient into the supine position, you have to provide comfortable position, that is the supine position to the patient, and assess the administering the anesthetic agents like thiopentanol sodium, that is 3 to 5 milligram IV they have to insert and giving to the patient, and you have to wait all muscle relaxations can paralyze to the muscles, respiratory, even respiratory muscles also. Then you have to ventilate support provide to the patient. So, then you have to assess placing the electrode into the correct position, applying of the gel and keep the mouth gag into the patient mouth. So, we have to prevent the tongue bite and then apply the gel and monitoring the voltage. How much voltage we are giving, mainly into the 70 to 120 volts we are giving, and monitor the seizure activities. You have to 100% oxygen saturation should be maintained to the patient, and you have to watch the ECG of the patient and electroencephalogram monitor we have to check. So, these are the intra-ECT care to the patients. So, next one will be the post-ECT care. After finishing of the ECT, so you have to monitor the vital signs and continue with the oxygen till the patient is taking spontaneous respiration, and then assess the post-ictal confusion and restlessness to the patient. If the confusion will be more restless, the patient is having the restlessness, you have to administer the intravenous diazepam to the patients, and then reorientation should be there to the patients. So we have to reorientate to the time, place, person, and we have to orientate to the environment and friends and family members, and then finally you have to document the findings into the patient record. So this is regarding to the ECT. The ECT is the, so till now we coming to the summarization. So till now we discussed regarding to the electroconvulsive therapy, and previously they will called as the electrical shock therapy. So we have to artificially producing to the grand mal seizure to the brain. The brain will be activated, that is will be there into the definition parts, and we discussed regarding to the, so what are the parameters we are followed, types of ECT, indications, contraindication and mechanism of action, side effects, and role of nurse into the ECT care, that is pre-ECT care, intra-ECT care and post-ECT care. Thank you one and all.